Dr. Jim Orvick from the Oregon Pet Clinic is here taking your calls at 270-9933. How are you?
Oh, great.
All's well.
All's
good.
Fine.
Let's solve some problems then. We'll
Okay,
start with
yes.
Russ in Sun Prairie. Hi, Russ. What's your question?
Hello. I've got she's about 1.5 years old, mini schnauzer, that pretty much any time you come in the house, even if you go out in the backyard, much less being out on errands or something, she cuts loose with the most piercing squeal. Mm-hmm. And she keeps it up for a long time. And just like, I would love to see that, toned down. I've tried the usual stuff like ignoring her and things of that sort. Mm-hmm. Doesn't help any. Mm-hmm. She's also quite a talker, though, which might be part of it. She'll chirp and warble and all sorts of stuff at us. I have that issue, and then she's also, when my young grandkids, which are like 2 or 3 years old, come over, she'll get kind of threatening with them if they get too close to her.
Yeah. That's common Schnauzer attitude.
A couple of things went on there. Something a little separation anxiety.
Well, yeah, that shrill barking, I mean, that's a bad habit that she has, and things that can be done to break that without physical, just trying to stop her. They have bark collars that some of them will just spray a spray that they don't like the smell of. There are some that will shock, and there are shock collars too, which I've thought, if it solves the problem, it's worth it. It's like the invisible fence. Mm-hmm. It works fine. But the extreme would be to remove a vocal cord, debark surgery, which isn't as bad as some people make it seem, I don't think anyhow. And it won't make her stop barking, it'll just lower the frequency a lot.
Okay, and with the kids?
The kid aggressiveness, that you might want to talk to a dog trainer about, behavior specialist about that.
Yeah, that's not a good combination.
No, we ended up with a Schnauzer because it bit at other people, and
really?
It bit our kids too.
All right, let's go to Tricia now in Oregon. Hi, Tricia.
Hi, how are you?
Hi, what's your question?
Hey, I have 2 cats. There's a young one, and we had an older one, and he went to live with my son, and my son had went off for the Army, and we got the cat back. Well, at first they were getting along fine, and they were both going in the same litter box. Now, all of a sudden, I'm finding that, I don't know which one, there's 2 areas in the laundry room where there seems to be consistent piddling on the floor. Now, I just got them the shock collars, so they couldn't come into the family room area because they were scratching up the leather and stuff. So I don't know if it's possibly stress or if it's a bladder situation or what it is. Could you give me some advice as far as what I can do? I mean, I've tried to bleach the area, and I put down that pet sanitizer thing, and it seems to still be consistent.
Yeah. Well, if it is a bladder problem, the cat should be checked out, and that probably should be done just to make sure there isn't one. If it's behavior, lots of different things that can be tried and may or may not help. But if it's the fact that this cat came back into the house and it's a territory thing, there are medications that help with that. I've known people who had more than one cat in the family, and if you put a second litter box out, it solved that.
That would help.
Yeah. And, well, the other thing is all drugs to try to change the attitude of
Try another litter box maybe.
Yeah, I'd do that
Get the bladder
first.
checked
It's
out.
Simple, yep, the
All right.
2 first things.